Hi sir, my name is Roni Srengga Anarayang. In this video, I will present about major plantation disease management in oil palm. The content in this video are the introduction to the oil palm, scientific name and common name of the disease, symptoms, the effect on yield, current control practices, and conclusion. The introduction to the oil palm. Oil palm is the commodity crop in some countries, especially Malaysia and Indonesia. Elaeis guineensis is an oil palm species that originated from the tropical rainforests of West Africa. Pests and disease currently pose a significant threat to oil palm cultivation. The crop yield can decline severely when affected by pests and disease that compete with the palm for nutrients and damage the trees. To suppress these attacks, the application of biopesticides and biological control methods are favored by sustaining the predators and parasitoids as well as pheromone trapping. The scientific name for this disease is common sparrowroot CSR. It is the most frequently observed disease affecting young oil palm throughout the world. The common name for this disease is crown disease. It is the most frequently occurring disorder in oil palm during the early years after field planting. It has been recognized in virtually all countries where the crop is grown and is particularly prominent in some plantings in North Sumatra. The crown disease are common during the juvenile growth of oil palm, but particularly during the first 2 years after field transplanting. However, disease palm may appear at the nursery stage, and some may still show symptoms after 7 or more years. Symptoms may be recurrent in a particular palm, and each attack may persist for a few weeks or several months. The symptoms are genetically diseased. Tissues affected spears are reddish-brown. The affected area spreads through the unopened spear, damaging immature pinnae. As the spear opens, it develops a very characteristic bend and distorted shape with the main bend in initial infection. The pinnae in this section of the front may be reduced to short stumps. Once the fronts open, the rooting usually ceases and the fronts expands and matures. For the effect on yield, crown disease significantly retarded vegetative growth and reduced cumulative yield of oil for the first 6 years of production by the 4.5%, with the highest loss in the first year. Crown disease is the most frequently occurring disorder in oil palm. The current control practices for crown disease in the areas where the disease is persistent: cutting back the spear as close as possible to the base, followed by drenching with a fungicide, may reduce the spread of the disease. In conclusion, there are so many diseases and disorders that affecting oil palm. One of them are crown disease, which is recorded as minor economic importance in some areas. However, these disease problems are smaller compared to the basal stem root (BSR). The cause of some minor disorders, such as brown germ, crown disease, and several other abnormalities, is unknown. That's all from me, sir. Thank you and have a great day.